Hi there, I'm Dr. Thanasios Soulis, and I'm a senior lecturer in the School of Medicine at Cardiff University. Today, I'll be giving you a sneak peek into some of the teaching that we deliver as part of Phase 1 on the C21 program, specifically in relation to psychological medicine and psychiatry. So as early as year 1, you'll explore the human brain in terms of structure and how structure relates to function. And by that, we mean basic biological functions, as well as emotional responses, certain behaviors, thought processes, and so on. So a good place to start would be the four lobes, and also the more primitive structures of the human brain. For instance, the brainstem, and the three parts of the brainstem that control our basic physiological and biological functions. The midbrain, the pons, and the medulla, playing a crucial role in temperature regulation, respiration, cardiovascular function, and so on. You'll also touch on the cerebellum, which plays an important role in movement and balance. The temporal lobe is something you'll cover as early as year 1 in relation to the structures within this part of the brain that play an important role in learning and memory, hearing, language, and many other abilities. The occipital lobe plays an important role in our ability to process visual forms of information, whilst the parietal lobe plays an important role in visuospatial ability, language, and other abilities as well. The frontal lobe is something that you'll also consider as early as year 1. It's the part of the human brain that has evolved the most recently, and it plays a crucial role in our higher cognitive functions. So for instance, your ability to make decisions, to think in abstract terms, to resolve conflicts, to solve problems. And it even plays an important role in what makes us individuals, our personalities, and so on. It's a part of the brain that we'll consider in relation to human development, as it's a lobe that takes the longest to mature. And it's also a lobe that undergoes significant structural change as part of the aging process. So we consider the frontal lobe and changes within the frontal lobe as part of normal aging, as part of pathology, and also in relation to neurodegenerative disease. We're also interested in the tracts, the white matter tracts that make up the brain, and how these play a crucial role in spreading information from one part of the brain to the other. So when we're talking about structural anatomy, neuroanatomy, what you'll be looking at are white matter tracts, gray matter, and how all of this relates to function. Now, those of you who have done psychology in secondary school will be familiar with the case study on the screen right now, Phineas Gage. What you'll do in years 1 and 2 is apply some of your basic knowledge of these case studies to more in-depth exploration of biological psychiatry and psychology in relation to neuroscience, neuropsychology, and so on. So you'll be considering, for example, how the case of Phineas Gage relates to structural and functional neuroanatomy. What exactly happened in the case of Phineas Gage that we can apply in a medical context? So Phineas was an individual who lived in the United States a couple of centuries ago. He was a railroad construction foreman who, as legend has it, on one fateful day, he was in charge of instilling gunpowder, fitting gunpowder into the ground so that they could blast surrounding rocks to fit the railroad tracks that were to pass through that particular region. So he was using the tamping iron that he's seen holding in the image here to actually compress the gunpowder into the ground. And the story goes that the tamping iron, whilst Phineas was distracted by one of his colleagues, struck one of the nearby rocks, thereby igniting the gunpowder and effectively turning the tamping iron into a missile. So our understanding of the injury that Phineas had sustained and what we see in his skull post-mortem was that the tamping iron had penetrated his cheek, went through his brain, and according to eyewitness accounts at the time, and you will know that eyewitness accounts aren't always that accurate, but they suggest that the tamping iron landed a few meters away from Phineas at the time. Now, what was remarkable about this particular situation was that the town's physician was called, and when he arrived on the scene, Phineas was sitting upright and talking. So what had actually happened in this particular instance? What parts of the brain was damaged that allowed Phineas to survive? Obviously, he was hospitalized following the incident. He had sustained, or rather he had a significant infection as a result of the injury, but he lived many years after the incident. But what many individuals at the time stated was that there were certain changes to Phineas's personality. He was no longer Phineas Gage. His responses were somewhat childlike. He appeared to struggle with inhibiting inappropriate behaviors and responses. But other cognitive functions appeared to be rather unaffected, as well as his basic biological functions being well preserved. So what we know in hindsight was that the part of the brain that was severely damaged as a result of this incident is a part of the frontal lobe we refer to as the orbitofrontal cortex. And the orbitofrontal cortex plays a key role in inhibition of behavior and responses. It plays an important role in personality as well. And that is why, in this case, we see that the damage to the part of the brain sustained as a result of this injury led to these significant changes in Phineas's personality and certain behavioral responses as well. Another case study that we touch on is that of Henry Molaison. And some of you may be familiar with this as well, but we're going to look at this in year one in relation to, again, structural and functional neuroanatomy and the neuropsychology thereof. So Henry Molaison was an individual who lived in the United States in the middle part of the 20th century. And as a young child, he suffered severe epileptic seizures. Now, the surgeon at the time, who was in charge of Phineas's care and who suggested a particular procedure, was known as Scoville. And Scoville suggested that the way to relieve Henry of his debilitating seizures was to remove a part of the temporal lobe, referred to as the hippocampus, or the hippocampi, plural. And what Scoville suggested was that by complete removal of the hippocampi, that would alleviate the distress experienced by Henry as a result of his seizures. So good news is Scoville was correct. Following the procedure, Henry no longer had these really debilitating seizures. However, what they didn't know at the time was that the hippocampus plays a crucial role in the creation of new long-term memories, in consolidating memories, creating long-term memories, specifically what we refer to as episodic long-term memories, and making that information more stable for long-term retrieval. So in effect, what had happened was that as a result of this procedure, Henry was unable to form new long-term memories. His recollection of events lasted only 20 to 30 seconds at a time. So he was literally stuck in the present. And accounts of Henry's experiences are quite heartbreaking. So Scoville was keen to get involved in all research to ensure, in relation to Henry's case, to ensure that this would never happen again to another patient. Now, as you can imagine, Henry was the subject of many studies and experiments as a result of the procedure and the impact that it had on his life. There were certain researchers he met for a number of years, day in, day out, whom he didn't remember having met the previous day. So severe was his amnesia as a result of the procedure. Henry lived to the ripe old age of 82, but his condition didn't improve. And that gives us an insight into what an important role the hippocampus plays in long-term memory formation. And upon his death, his family gave consent for Henry's brain to be cryogenically frozen and sliced and subsequently digitized and scanned to be stored for us to gain a better understanding of not only how structural damage can lead to the sorts of functional changes that we saw in Henry, but also to help us with our further understanding of the important role that these parts of the brain actually play in our ability to perform certain behaviors, in our ability to remember certain things, and our thought processes more broadly. Now, what you'll have in what we refer to as case-based learning are certain scenarios whereby you have the opportunity to apply your knowledge from the plenaries, from the lectures, to the scenario at hand. And this is an example of an image that is provided in one of our year 2 scenarios. So this is where you get to apply your knowledge in such a scenario. And what you'll have will be certain supporting sessions. Apart from the lectures, the plenaries, you'll also have certain practicals or tutorials where you'll get a better understanding of, for instance, in this case, the neuroanatomy and what you may be looking at in relation to the scan. In the anatomy center, you'll also have the opportunity to explore certain structures of the brain, blood supply to the brain, and so on. And in addition, you'll have the opportunity to actually handle the human brain and gain a better understanding of what the human brain actually looks like in 3D form. So at Cardiff University, we're lucky that we have some cutting edge research and the facilities that are able to support the research that is undertaken in relation to not only psychiatry, but also in regard specifically to genetics and genomics and how that may influence the onset of certain psychiatric illnesses. Now, in terms of your assessments, you'll have science-based assessments as well as clinical assessments. And in your science assessments, we have what are referred to as your science papers, where you have questions such as this, single best answer questions, whereby a scenario is presented. In this case, we have a 58-year-old male presenting with a severe impairment to long-term memory following a diagnosis of viral encephalitis, which appears to be affecting his consolidation of episodic long-term memory specifically. And you're asked what part of the brain is most likely damaged as a result of the infection. And you're given 5 options, one of which is the correct one, but you may have more than one correct answer. The point of the single best assessment is that you'll have to, as the term suggests, identify the single best answer. And in this case, it is the hippocampus, for the reasons that we touched on in relation to the case of Henry Molaison. We know that the hippocampus specifically plays an important role in long-term memory formation. And we also provide, as part of our feedback, explanations as to why the hippocampus is the correct answer. So I hope you've enjoyed this brief introduction to what teaching looks like in phase 1 of the C21 program. If you have any questions, please feel free to field them, and look forward to seeing you soon.